Okay, would you like to introduce yourself?
Hi, my name is Helen King. I'm a specialist nurse in the Hull Community DVT service based at the Westbourne Centre in Hull.
And can you tell us when you first introduced the Friends and Family test?
We first introduced the test back in August 2013.
Okay. And can you tell us what your thoughts were when it was first introduced?
It was a good idea. It gives an opportunity for patients and service users to give us their opinions on how well we did and things that they might want to improve or see differently done.
And can you tell us how the Friends and Family test works in the DVT clinic?
So what happens is the patient comes for their assessment, and they will have their assessment and treatment as they require. And as they leave the service, we ask them to fill out a small 4-question survey, which is on an iPad, which is based on the reception, which is opposite the exit of the centre.
And can you tell us what happens to the feedback that's given?
So that feedback is downloaded and it goes to our engagement team. Our engagement team go through all the responses, and a report is formed each quarter, which gives us feedback for the team.
I'm Helen Connington. I'm a specialist deep vein thrombosis assessment nurse, and I work for the City Healthcare Partnership in Hull.
And can you tell us what you first thought when you heard about the Friends and Family test?
I thought it was a good idea. It gives patients a chance to give us feedback instantaneously on the day that they come to see us.
And do you do anything to encourage patients to complete the Friends and Family test?
Yes, we always tell them that their test is at the end of our assessment, and our receptionists are very good. If they see the patients leaving the building, then they'll prompt them and remind them.
And what happens to the feedback that's being given?
The feedback goes to the central office and then it comes back to us by email.
And can you give us some examples of the kind of comments that patients have given to you?
Because we see all our patients on the day of referral, we get very, very good results from our Friends and Family survey. But some of the comments we have been about parking. If the patients complain to us about the parking during the assessment, then we always encourage them to fill the survey in, because this gives us some evidence in the future to go back to our managers and say that there is a problem.
Can you tell us the kind of comments that patients have given to you?
A good theme is that the fact that patients like that our service is a same-day service, so they're appointed at a time that's convenient for them. Also, we've had feedback that's saying about previously we used to have to ultrasound patients up at the Hull Royal Infirmary. Now, with the patient feedback, that was a good lever for us to have the ultrasound department located here, so we can do our scans on site.
Can you tell us what you think the main benefits are of the Friends and Family test?
One of it is it's easy to complete. It's on an iPad. The patients find it easy to use. Even our elderly patients are quite happy to use it, and our reception staff will always give them some support. It gives the patients a voice, and it gives them that time to think and reflect on what we've done, and then they can fill it in for us.